Prostate cancer. It's the second leading cancer death in the United States and worldwide. In fact, some people say lung cancer is second after breast cancer in some populations, but in other worldwide, basically prostate cancer is the second most common cancer. And you see the incidence, you see the map here I put of various parts of the world where prostate cancer is common, in the darker blue areas. Well, do you see any relevance to the economic wealth of the people in these particular areas in the dark blue? Do you have any idea what these people eat?
Bonjour les amis, vous êtes extrêmement nombreux à m'écrire j'ai le même cancer que toi, qu'est-ce qu'il faut faire et tout. 1, je vous rappelle que je ne suis pas médecin. 2, rassurez-vous, on est très peu à mourir du cancer de la prostate. Habituellement, on meurt avec le cancer de la prostate. C'est ce que nous expliquera le monsieur demain sur cette vidéo que je vais vous retransmettre. En attendant, je vais vous parler d'un autre médecin, un médecin qui a compris ce qu'est le cancer de la prostate, qui a compris ce qu'il faut faire ou ne pas faire. À lui.
In Brazil and Argentina used to be the biggest consumer of beef in the world. They had the highest incidence of colon cancer in Brazil and Argentina in the world. Europe, Australia. Do you see the pattern? Rich foods give you prostate cancer. So in the US, there are 288,000 new cases and 34,700 deaths. That's a lot of difference. That's like 1 in 10 people die who get it, right? In other words, 9 out of 10 could have been spared even finding out that they had it. I think so. All right, so this is the mistake that I would guess most of our listeners are making, and unfortunately, most of my colleagues still don't have this understanding of cancer within their grasp. They just don't get it. So they don't know why patients don't do well. They don't know why early detection tests don't work. Why we have limited benefits when it comes to cancer. Anyway, mastectomies don't work. Prostatectomies don't. We're going to get into that. The reason is that people believe the following. They believe a cancer starts as a little area in particular one organ, breast, prostate, colon, etc. It starts as a single cell, and then it grows in that particular tissue. And it keeps growing and growing and growing, and finally it gets really big. Well, maybe not that big, but maybe that would be big enough. And when it gets bigger, then it metastasizes. And it doesn't metastasize throughout the body first. It goes to the lymph nodes first. And then past the lymph nodes, it goes to the rest of the body. And this is why, most surgeries are attached with an extra surgery, which is to remove the lymph nodes, is because doctors, not a scientist, not a people who understand what's going on, they understand there's a centripetal event that goes on where they believe it's in stages, little cancer, big cancer, spread to lymph nodes, then spread to the rest of the body.
That's believe it. I mean, it's been like 100 years.
They've known this for at least 80 years. I've been talking about it for 45.
I know. And everything else, well, no, it doesn't seem like everything else is catching up. I think of a few things that are catching up.
People believe in logical things. This is logical.
It is. And you're right. It is logical.
It fits into the way that they've been treated. We take the breast or colon cancer out, prostate cancer out, and then we take the lymph nodes around it, because that's our second area of defense, where we stop that cancer, the lymph nodes, and then to the rest of the body. But that's not the way it happens. The way it happens is this. A cancer begins. Let's just talk about prostate. We could be talking about breast. We have under many circumstances, but this could be colon cancer, prostate cancer, lung cancer, any solid tumor. It starts as a single cell that gets injured. And most cells are not allowed to double anytime they want. But once a cell gets injured, it loses this neighborliness, this friendliness, and it starts dividing in its own free will. Now, cells are allowed to divide, say, when you're growing as a child, or say you cut yourself, you have a wound, the cells can replicate and close the wound. Otherwise, if your cells were allowed to divide at their own free will, you'd be a misshapen lump in a matter of hours. So it's not allowed unless they get injured. And then they start dividing at their own free will. So let's begin with cancer cell begins. It divides at a regular rate on average of every 100 days. So in 200 days, you got 4 cells. A year later, you've got 8 to 12 cells. A prostate contains 100 billion cells per prostate. And then you go to 64, you've got 2 years of growth. A tumor less than 100 cells lurking in a mass that contains 100 billion cells. You can find that with a team of pathologists. All right, divisions continue. 2 years, it's not detectable. Finally, it gets to be a 6-year-old disease, and you start to maybe find it then. It's a millimeter in size. It contains 1 million cells, all right? And as I didn't say 100 billion, I meant 1 billion. You can finally detect it at 1 billion cells in growth, which is 1 centimeter in size. It's about the size of an eraser. That's when the doctor can feel it on a prostate exam. That's what you can find out on these imaging techniques. The tumor is about the size of a small marble, an eraser of a pencil. It has to grow to that size, taking 10 years on average before it gets big enough, 1 centimeter, 1 billion cells, before it gets big enough to elevate what we call the prostate-specific antigen, which is a blood test used to diagnose prostate. It's been growing for 10 years on average. And doctors don't feel it until it's at least 10 years old on average. Except no tests find it on average until it's 10 years old. By that time, it's spread. How is it spread? It's broken off into the venous system, the veins. It spreads to the liver, the lungs, the bones, the brain, etc. Now, yes, it does go to the lymph nodes, but that's incidental. Okay, these lymph nodes are there to protect you. They fight against the cancer, yet doctors are so busy taking them out. This is your defense mechanism, these lymph nodes. And it does not spread from the tumor to the lymph nodes and then to the rest of the body through the veins. It goes from the tumor into the veins to the rest of the body. Okay, now don't forget that it takes 1 centimeter in size to elevate the PSA level. That's the blood test. That takes 10 years on average. All right. So we have this test called a PSA, prostatic specific antigen. It means it's a protein that is derived from the prostate gland that gets elevated when the prostate gland gets inflamed, irritated, or when it develops prostate cancer. Now, as men...
Excuse me, that's a blood test?
Blood test, yeah, little blood test.
Okay.
So you have all these screening programs. Doctors are out there telling you, you're a bad person if you don't get your PSA tested. Everybody's got to get their PSA. But not so much lately, because the medical profession has come to realize what the truth is of this testing and treatment, which you're going to learn about today. If you randomly select men off the street and you get a blood test on them, 10% will be positive for PSA. So you got a 1 in 10 chance, if you allow somebody to have your blood, a 1 in 10 chance of having an elevated PSA. And then you're told to have a biopsy. It's not a biopsy, it's 12 needles that are stuck through your rectum into your prostate gland. And in the process, they injure the nerves of the prostate. We'll talk about that in a minute. Okay, so 10% of men are going to be found randomly picked off the street. Of those who have a positive PSA, about 30%, depending on their age, are going to be found to have prostate cancer. Whoa! Depending on the age, 8% of men in their 20s have a positive PSA for prostate, or positive biopsy, excuse me, for prostate cancer. 30% of men in their 30s have a positive biopsy. 50% of men in their 50s. And men my age, it's almost 100% have prostate cancer on biopsy. But that's on biopsy. You can have cell changes occur in the prostate without it going on to metastasize. And that's what happens in most cases. Or it's so late in its metastasis process, it's spread, that you die of something else first. Okay, what happened to, let's see if I got everything I tell you. Oh, as far as this, one other thing you got to know about this PSA testing. I told you they stick 12 needles in your prostate through your rectum. Gentlemen,
This is the biopsy. This is not the PSA test.
this is the biopsy, right?
Yeah, okay.
Okay, now keep me on track.
All right.
This is the biopsy right here. Okay, so I told you that that 30% of men with a positive PSA, which is 10% of men, on average, are going to have a positive biopsy based on the needle biopsy. But the needle biopsy is 12 needles stick in your prostate gland. Yeah. This damages the prostate gland through which the nerves that control your erectile dysfunction pass. Erectile function pass. The nerves that control your erectile function, that's your penis. They get injured. 41% of men report erectile dysfunction 1 month after surgery. And for 15%, it becomes permanent just from the biopsy.
Et oui, les amis, ce docteur a raison. J'ai eu ma biopsie, résultat de 57, mon PSA est passé à 87. J'ai eu effectivement des douleurs pendant un certain temps. En ce qui concerne les lymph nodes, c'est-à-dire les glandes lymphatiques, mes glandes lymphatiques avaient gonflé énormément. L'une était passée à 3,6 et l'autre à 3,2, quelque chose comme ça. L'une est revenue à la taille normale relativement rapidement et l'autre a mis facilement 3 ans en descendant régulièrement. Donc c'est bien que les lymph nodes, les glandes lymphatiques, se battent contre le cancer, capturent les cellules du cancer et à l'aide de macrophages, les détruisent. Et à ce moment-là, si on enlève un filtre, comme je l'ai dit lors de l'interview avec notre ami Eric Berg. On enlève un filtre et on se fragilise. Alors ceci, qui c'est qui l'explique bien? L'Institut Weizmann, un grand professeur connu, qui nous expliquait ça. Mais depuis des années, depuis plus de 10 ans, les amis. Et en France, on continue, ou aux États-Unis, à retirer les lymph nodes simplement parce qu'on voit qu'il y a des cellules de cancer dedans. Et donc on se dit qu'il faut les enlever. C'est parce qu'on n'a pas compris. Certains médecins, pas tous heureusement, ne suivent pas l'évolution de la science. Et aujourd'hui, on a compris ce qu'est une tumeur. Une tumeur, c'est tout ce que notre corps ne peut plus éjecter. Alors, qu'est-ce qu'il fait, notre corps? Il essaye de nous protéger. Et en nous protégeant, il crée une tumeur. C'est-à-dire qu'il fait un sac. Il met dedans tout ce qu'il n'arrive plus à éliminer naturellement. Et à ce moment-là, si on continue, bien sûr, à manger, comme il dit, vous voyez, nourriture trop riche, etc., eh bien, le sac, il grossit. Voilà, les amis. Vous avez tout compris. Mais ce n'est que le début. Ce n'est que le début, parce que je vais faire toute une série sur le cancer de la prostate pour que vous compreniez bien. Mais vous avez entendu aussi que 10 ans, alors entre le moment où on vous trouve un cancer et entre le moment où vous risquez d'en mourir, il se passe des années, les amis. Alors, n'ayez pas peur. Le seul cas, et ce médecin nous l'explique vraiment, c'est quand vous avez un cancer stade 4 qui a métastasé. Là, il faut agir tout de suite. Et alors là, vous choisirez votre méthode. Merci les amis. Très très bonne journée. Au revoir.